You have a busy session, so we'll keep this under 40 minutes. We're going to look at how medical practices can deploy a unified AI operating system and automate all the inter-workflow and cut back office overhead. To break this down and how this deployment architecture works, I'm joined by Raghu Bala, the CEO of Synergetics, and also Eshwar Kupa from the Clinitraq team. Raghu, Eshwar, great to have you here. Raghu, I'll hand the floor over to you to kick things off.
Sure. Thank you, Ricardo. Thanks everyone for joining today. And Ishwar and I will walk you through Clinitraq AI, which is a initiative of Synergetics, which is a technology company which is building an agentic AI platform. So one of our focus areas is Clinitraq, which helps medical and dental practices automate all of their functions. And we're going to walk through the various aspects of how AI is leveraged in medical practices and dental practices to enable these operations to be much more effective in terms of efficiency, in terms of cost, and also in terms of the quality of care that's provided to all of the patients who come to these facilities. So with that, let me get going here. So one of the main drivers of all of this initiative in terms of the use of AI and so on is because there's a real problem. So the first thing that you can focus on here is the 62%. So medical practices and dental practices live and die by the inbound patient calls, whether it is new patients that are being taken in or appointments that are being scheduled and so on. So when those inbound channels are not sort of uh, managed properly, what will happen is you lose patients that way, and the patient satisfaction goes down. And then these patients also have various other alternatives. They can go to other practices, they talk to friends, family, and get referrals elsewhere. So that sort of really impacts the revenue base of these medical and dental practices. So handling customers is a very, very big part of the equation. The second big part of the equation, and this is a little less obvious, but in speaking with doctors and clinicians of different sort of specialties, what we have really honed in on is this 47% number. It's a very important number, which is the amount of time when the clinician, the patient, or sorry, the doctor or even a registered nurse is spending time with the patient, what they're doing is they're taking notes and not making eye contact. And when they don't make eye contact, the feeling among the patients is that they are not being taken care of because the sort of physician is listening to you, but not really making eye contact and taking notes because the physician is worried that he's going to let something drop on the floor. So he wants to get all the notes down, and then he spends a lot of time on administration, having to enter them into EHR systems and so on. So that really reduces the quality of care. So if you just look at these two numbers, this is the reason why AI can make a huge difference in the efficiency and the level of care within these organizations. Okay, now when we look at a medical or dental practice at a high level, there are sort of like 4 to 5 areas that we can sort of hone in on. The first one is the calling that I talked about earlier. So the whole time, whether it goes to voicemail or call is missed, or someone just gets tired of holding on and being put on hold and drops the call. All of those things are the first bucket. The second one is all of us in North America, we know that when we go to a medical practice, they ask you to fill out a large form when you are there for the first time to input all of your what do you call it, past medical history, all of the things that you're allergic to, the conditions, the pre-existing conditions. So it's a long, I would say 10, 15, 20 minutes of data entry and usually manual. And then that gets taken in by the admin people, and then they have to re-enter that into the medical record system. Hopefully they can read your writing in the meantime as well. So it's a big manual process and sucks up a lot of time. The third is when patients call or something for scheduling, there's a lot of phone tag that goes back and forth, and then a certain percentage of people don't show up. So that's also a problem because an appointment is tantamount to I compare it with the hospitality industry where there is a hotel room which you cannot rent out for the day. That's revenue that's not coming back tomorrow. Same thing with airplane tickets. The scheduling window for a clinic is the same thing. That 1 hour window, if no one shows up or you don't fill it, you lost that revenue opportunity for the future. So it's gone. It's never coming back. Then the next part we want to focus on is claims and billing. This is another area where there's a lot of sort of like contention between the provider and the payer, which is the insurance company. Sometimes the wrong ICD-10 or CPT codes are entered. That results in certain back and forth with the insurance company in terms of reimbursements and so on. And these denials also take a lot of time and rework, and sometimes it can take 30, 60, 90 days to resolve these problems. And finally, the last one is the fifth one, which is you want to sort of take a step back and look at your whole practice from a holistic standpoint in order to do analytics. And that is not currently done in many practices because they're busy doing their day-to-day work. They don't step back to see, hey, where are the gaps? Who can we be calling back, which is a call that we let slip through? Or where are the areas where we can be improving our practice? So I think that's a huge improvement that we can bring about using a lot of analytics because we are collecting data all along the way during different workflows that govern the operations of a practice. Now, in terms of what we're going to see today is actually a combination of various technologies such as voice agents, the CRM, the integration with the EMR, the integration with insurance for pre-auth, and then analytics and call intelligence. All of these functions we're going to see. And it's going to reduce the amount of time consumed when compared with the manual way of doing things today. So if we look at it from two sort of vantage points, one is the medical and dental practice on the left and the patient sort of purview on the right. So if you look at it from a medical and dental practice, there's a lot of sort of cost that goes into the administration of a practice. And then in terms of, or even the personnel in those administrative functions can be better utilized because doing busy paperwork is not really improving your bottom line or your top line within a medical or dental practice when you're looking at it from a P&L standpoint. The next is whatever that we are going to be showing today is not a long sort of integration cycle. It's a turnkey. It's improvements that you can make immediately to your practice and derive the benefits relatively fast within a month to 2 months, and you're going to get those benefits for the foreseeable future. The next thing that comes up is whenever you introduce any new technology, there are compliance type issues in the medical and dental space is HIPAA, which governs the sort of how data is stored, transmitted, and so on. So we have a platform that is HIPAA compliant. We are held accountable by a firm called Accountable. They are our auditors for HIPAA. And so we had our HIPAA annual sort of certification and recertification recently as well. Now, in terms of this last point of real-time visibility, that is something that I talked about earlier with analytics. Because there's no visibility, it's like people who are operating these medical practices to a large extent are like equivalent of driving a car without a speedometer. You don't know whether you're going fast or you're going slow. And so that is not helpful when operating any business. So getting that visibility is very critical. Now, from the patient standpoint, um, the number one complaint, I think all of us as on the consumer side of things, of these services, always feel that we get put on hold. And that's very frustrating. So with the use of technology, that whole time becomes zero because this can be scaled, unlike manual operators of which you can only have a finite number. Now with AI, these voice agents can be spun up on demand. So if 10 calls come in at the same time, no problem. If it becomes 20 within a minute, no issues at all. Or if it drops down to two, no issues. You're not paying for extra capacity. You're simply being able to throttle back and forth. And that's a big advantage. The next is in the past, a lot of people have had experiences, all of us have had experiences where we call into a bank or some other voice agent, and you're typically shouting over that voice agent because it is not an AI-based voice agent, it's simply an IVR system. So the last generation technology was very poor in the sense that it had a rote learning model and it go down a menu structure, and it was not sort of amenable to make decisions or to be able to listen and react accordingly. Now with the new technology, it has not only a human-like voice, but it has great comprehension capabilities, which is what comes with natural language processing. And just for background, I actually teach AI at MIT, and I've done so for the last 10 years. So now, if you start to utilize these capabilities in the right way, you have a natural conversation, an agent that's actually listening like a human, and it's got a sort of encyclopedic knowledge of the practice, procedures, timing, schedules, all of the things that you're looking for, it knows. It doesn't need to forward you from person one to person two. Sometimes you get that sort of like merry-go-round that you call certain services. They say, "Oh yeah, we can't answer it. We'll forward you to someone," and then they can't answer it. They'll forward you to the first person again. And I've had, and just like all of you, gone through that. That goes away with this technology because these agents are trained to answer everything comprehensively. And then the time it takes to make an appointment booking is fast because of the new capabilities in AI and so on. And then, in terms of being proactive, whenever there are appointments that are supposed to happen and so on, you'll get a notification so that you don't forget and you can not miss your appointments and so on. So now, with that said, we're actually combining four technologies: voice agents, CRM. So a lot of the common CRMs used by medical practices, such as Go High Level and so on. We have integrations with EMR systems. We have sort of a bridge into all of the popular EMR systems used by medical practices and dental practices. And then this practice intelligence, we've really upped the game there in terms of adding capabilities for recovering your revenues or going into various interactions that happen in the voice calls, and also looking at estimating cost for certain procedures so that you can bill the patient for the copay, as well as get the right analytics you need to kind of figure out how to negotiate with insurance and so on. So a lot of capabilities that have been added to make that practice intelligence, live up to its name. So with that said, I just want to walk you through a few small things and then we'll jump into all the demos. So incoming interactions with patients and so on can be in the form of voice, phone call, web forms, SMS, email, and so on. And on each level, there are different types of pieces of the technology that's handling these interactions. And then on the back end, there's practice management systems, electronic medical record systems, insurance systems, labs, and pharmacy, and so on. So there is a sort of easy handoff between the ways of interacting with the medical practice and all of the external or internal systems that are existing in these practices. So there's no huge sort of change that these practices need to make in terms of their IT infrastructure or their external partners such as payers and so on. But we have kind of a seamless experience with all of these existing systems and practices so that implementing our solution becomes relatively painless. And then in terms from a marketing standpoint, it's very important to attract new sort of patients and so on. And so this funnel in terms of awareness creation, inquiry, and then getting qualified leads, leading to a consultation, and finally converting into a patient who's a repeat patient for a period of time and so on. We have developed all of this with the funnel in mind. Okay, now what I'm going to do quickly is to hand off to Ishwar so that we can walk through the first demo. And Ishwar, you want to take over from this point?
Yeah, sure. So first, we're going to look through a voice agent demo. And the main things that you'll see on this call is basically, I'll say three phases. Number one is going to be the discovery phase on the call. So as we do the call analytics, and this has been running for, a bunch of practices, we've gathered a bunch of data and we see the positives and negatives that human agents actually have when they're taking phone calls. Now, one of the negatives is that sometimes a lot of human agents handle calls in a very transactional way. So um, they don't take the time to make the patient feel comfortable and feel heard in the interaction. A lot of the times what we'll see is the patients will or the agents will just move to directly like, hey, what's your insurance? Can we book you? This is how much the procedure is going to cost, like without actually understanding the patient situation. So the first thing you'll see on the call with this voice agent demo is a discovery arc where the voice agent is going to actually inquire about the patient situation, do so in an empathetic way. And then once it has all the clinical details that it needs, it's going to move to insurance authorization and verification. So we have a real-time insurance eligibility check. So we could collect the patient's insurance details on the call, run a live check, which will return a response in a few seconds, and provided the patient's insurance is accepted, then it'll move on to phase three, which is actually the booking. And the voice agent will go and book the call, book the appointment on your actual PMS or EHR system, whatever you use, so that it's completely automated end to end. And you'll see that flow now. And the good thing about this is a lot of voice agents, uh, say that they'll book calls for you while you're not there, but they don't actually have the necessary integrations to do so in a truly autonomous way from end to end. But this lives up to that, right? You have actually the full flow, make sure the call is good quality, make sure we're scheduling, insurance eligibility, so to make sure we're getting the right patients in and then actually scheduling it onto your calendar. So you can,
Let me play it now, huh? Okay.
Good morning. Thank you for calling Dr. Reddy's. This is Olivia. How may I assist you today?
Hi Olivia, I've been having pretty bad knee pain for a while now, and it's getting harder for me to walk. I think I need to see an orthopedic specialist.
I'm sorry to hear about your knee pain. That sounds really uncomfortable. Let me get you scheduled with one of our orthopedic specialists. May I have your full name to start?
Sure, my full name is John Doe, JOHNDOE.
Thank you, John. I have that as JOHNDOE. Did I get that right?
Yes, that's correct.
Perfect. Could you tell me a little more about what's been going on with your knee? When did the pain start, and how would you describe it?
It started about 6 weeks ago. At first, it was just a dull ache after I went on a long hike, but it's gotten worse now. Now, it hurts when I walk upstairs, and sometimes my knee feels like it's going to give out. There's also some swelling on and off.
I'm sorry you've been dealing with that for so long. Have you had any prior treatment for this? Surgery, physical therapy, anything we should know about?
I twisted it playing soccer years ago, but it healed up fine. Nothing recent.
Got it. Have you been seen at our practice before, or would this be your first visit with us?
This would be the first visit.
Thank you. Before I find you an appointment time, I'll need to verify your insurance coverage. May I get your member ID from your medical insurance card?
Sure, my member ID is A2CBCBSTX123.
Let me read it back exactly as you said it. A2CBCBSTX123. Is that correct?
Yes, that's correct.
Perfect. And what's your date of birth?
My date of birth is 1st of January 2015.
Thank you for your patience, John. Your plan is active, with a $25 copay for office visits, and your deductible is $4,000 remaining for the year. Shall we go ahead and find you a time?
Sure, let's go ahead.
Great, and I can get you in with Dr. Salk, our orthopedic specialist. Given your symptoms, I'd like to offer you something soon. How about tomorrow, Wednesday, at 9 in the morning?
Would it be possible for me to get an appointment on May 11th at 2 p.m. Eastern Time?
Perfect. I can get you in with Dr. Salk on Sunday, May 11th at 2 in the afternoon. Let me get your information to complete the booking. Since this is your first visit with us, I'll need to create your patient record. What's the best phone number to reach you at?
Sure. My phone number is 914-415-8433.
Thank you. Let me read that back. 914-415-8433. Is that correct?
Yes, that's correct.
Great. And what's your email address for the appointment confirmation?
My email is john@gmail.com.
Thank you. I have that as john@gmail.com. Is that correct?
Yes, that's correct.
Perfect. And what's your home address for our records?
My home address is 248 Beacon Street, Apartment 2, Boston, Massachusetts, 02119.
You're all set, John. Your appointment with Dr. Salk is confirmed for Sunday, May 11th at 2 in the afternoon. You'll receive a text and email confirmation shortly. Please plan to arrive about 15 minutes early. Is there anything else I can help you with today?
No, that's everything. Thank you so much.
As soon as the agent confirms the appointment with the patient, it appears in real time on the doctor's PMS calendar.
Okay, so let's move on to the next one. So, Ishwar?
Yeah, so next we're going to be demoing the ambient listening tool. So we touched on this a little earlier, but the purpose of this is for the doctor to be able to give their undivided attention to the patient in the clinical room and make sure they're not distracted with having to type their clinical notes. So we use the top of the line medical transcription model. So we make sure that we're getting you an accurate transcript. It's going to be diarized, so speaker labeled, when the doctor's talking versus the patient talking. And then by the end of it, we'll have a visit summary generated, SOAP notes as well, and everything's going to be, again, automatically pushed to your system of record, whether that's your PMS or EHR.
Okay, so let's watch this really quickly.
During the visit, the ambient listening agent passively captures the conversation between the doctor and the patient with consent. Behind the scenes, 4 things happen automatically. 1. Transcription. The entire audio is transcribed in real time into an accurate, speaker-labeled text record of the consultation. 2. Summary generation. A concise, easy-to-read summary of the visit is generated, highlighting the patient's concerns, key findings, and the doctor's recommendations. 3. Clinical notes. Structured clinical documentation is generated in the standard SOAP format, capturing everything the doctor would otherwise have to write up manually after the visit. 4. Sync to PMS. The summary and SOAP notes are automatically pushed into the PMS dashboard and attached to the patient's record as a downloadable PDF. As a result, the doctor walks out of the room with their notes already written and the patient's record updated in real time.
Okay, so this last component that we're going to demo is the whole you can think of this as like the operational spine of the practice. So the goal with this is to be able to support you with data from your real workflows at every step along the way, starting from the very first phone call that a patient makes to your practice and connecting that to the in-person interaction they have, which is with the ambient tool, and connecting that journey along with even after the treatment is served, we'll have tools to support you from the revenue cycle side of things. So this is the operational side that runs through the entire workflow and the entire journey of a patient and gives you the analytics at every stage. So let's play the video and then I'll talk through something afterwards.
This is Clinitraq.ai, a practice intelligence platform that turns every patient interaction into actionable data. We're going to walk through a live dashboard for a multi-specialty healthcare group so you can see exactly what your team gets from day one. Full patient journeys, AI-powered call scoring, automated revenue recovery, and coaching that writes itself. Christopher Delgado has called this practice 4 times over 6 weeks. Every conversation is scored, every objection logged. Whether he booked, what objections came up, and how the conversation went. Over 50 practices are already running on this level of visibility. Most of their competitors are still guessing. Now, when a call like that doesn't convert, it doesn't just disappear, it gets caught here. This is the callback queue. Every missed booking is ranked by how much revenue is at stake and how likely the patient is to come back. Your front desk knows exactly who to call first and why. Like this one, spine surgery consultation, $15,000. The patient called in with an MRI ready to schedule, but got tripped up on insurance coverage. The system caught it, scored it, and wrote a full playbook for the callback. What went wrong, what to say, even a follow-up message ready to send. Your team just picks up the phone. And that kind of pattern, where insurance questions derail the booking, it doesn't just stay in one patient's file. It bubbles up here. The coaching queue finds the biggest patterns across your team's calls and writes the coaching script for you. These aren't generic tips. They reference specific calls, highlight what's already working, and tell you exactly what to adjust. Your office manager doesn't have to listen to a single call. This is ready before they sit down Monday morning. All of that intelligence starts here. Every call, scored on a 100-point scale, categorized by call type, and surfaced in real time. Lots of software simply analyze every call that goes through the system without any classification. This actually corrupts the data pool, mixing real patient calls with admin, spam, and irrelevant calls. Our analytics system starts with a classification gate that ensures only primary calls are being incorporated into your metrics. You can see booking rates, score trends, duration, all at a glance, and you can drill into any individual call. This is actually the same patient from the callback queue. You can see exactly where the call broke down. The agent quoted costs before checking insurance, and a $15,000 consultation walked. When you zoom out from individual calls, this is what you get. Daily performance trends, booking rate over time, and a service heat map that shows you which procedures are driving volume and which ones aren't converting. You can click into any service line and see the actual calls behind the numbers. And then all of that rolls up into this. conversion analysis, scoring breakdowns, objection patterns, and a weekly narrative summary. This is the page your practice group leadership opens. Everything distilled into one view. And the longer you're on the platform, the sharper it gets. The system learns your practice's patterns, your patient mix, your team's tendencies. So the recommendations get more specific over time. It becomes intelligence that's custom to you. And that's not something a competitor can just copy. Front desk, office manager, executive team. Every layer of the practice covered. 50 plus practices and some of the largest healthcare agencies in the country run on this. They're not wondering which patients to follow up with or where revenue is leaking. They already know. That's Clinitraq.ai. Practice intelligence that works for you from day one and gets smarter every week.
Okay, so to talk a little bit more about that, the whole idea behind that is that there's data leakage at the connection points, like at the seams in the practice, right? So if you think about patient call one versus call two, connecting that to the in-person interaction to the billing afterwards, that's where the value is in connecting that entire workflow. And one thing that wasn't shown in that video was the whole revenue cycle side of things. So what we're able to do on that is we have our in-house insurance eligibility tool. So that allows you to manage verification from one portal instead of having to manage, 15 different portals for all of your separate payers. And that'll return eligibility in real time. You can get the eligibility status along with all of the benefits. And then we built a cost estimator that leads, that follows that. So you can put in the specific CPT code and then get an accurate cost estimate based off of your actual fee schedule. And then we've also built in an automated feedback loop. So once you're able to, get the cost estimate, once the claim actually comes back from the payer for that procedure being paid, we check our initial estimate against the actual paid amount, figure out if there's any discrepancies, and then update the cost engine automatically based off of that. So you get an engine that's constantly improving over time. And then we also have the claims analysis. So when claims are coming back from your insurer, we're able to automatically flag if there's denials, underpayments, any issues on that side of things. So the whole revenue cycle is covered. And actually, one of the practice groups that we're working with right now is using this to actually completely transform the way that they do the revenue cycle. Because we have the ability to deliver accurate cost estimates when all the tools that they've used beforehand haven't had that feature. They're starting to be able to collect payment upfront from patients, so they're completely changing their revenue cycle. So that's just some of the examples of what can be done with this whole Practice OS operating system.
Cool. So that brings us to the sort of like end of the presentation. I'm handing it back over to you, Ricardo.
Yeah, thank you. Thank you, Raghu. Thank you, Ashwar. Yeah, we have a couple of minutes, so I want to open the floor for questions. So if you have any questions, please feel free to drop them in the chat window. Harish, I don't know if you can help me also see if we get any questions from the attendants. I don't see anything. Okay,
You might
well,
also want to share an email address or something so that if they have questions after the webinar, they can also send it to you.
yeah, and if we didn't get your question and you want to sort of delve into this a little bit more, we do have a question, Raghu. Dr. G is asking, what is the cost of this?
So typically we have three packages, which almost measures up with the size of the practice. If it's a single location, typically it's about $3,000 a month. If it's a multi-location practice with multiple physicians and so on, let's say a medium-sized practice might be around $5,000 a month, and then a larger practice might be close to $9,000 a month. So it's about three, I would say three, 5 to 6, and then 9 in that range. Now, in terms of the capabilities are same across the three practices. It's just the number of the scaling we have to do in terms of voice agents to deploy and things of that nature. Also, a lot of practices that we work with, sometimes they have some custom things that we have to develop for them in addition to the platform. So we are open to looking at those issues as well. And that sometimes happens because we actually have got customers in some nuanced areas like workman's comp and other things, which require some special handling as well. So.
Yeah, to expand on that a little bit, once we have the whole system running and we're able to ingest the data from your practice, what we can do is also with some of our clients, we're asking them what are their day-to-day operational workflows, and then we're seeing what can be automated and turned into agents. Because now that we have the whole system, the data for the whole system, it becomes much easier to deploy these agents that are connected with everything and then help automate a lot of the operational tasks on a day-to-day basis.
Thank you for the question. Anyone else?
Seems that we don't have anyone else here. Okay, we'll be sending the recording via email and also with a link to book anytime with us. And with that, thank you, Raghu. Thank you, Eshwar. Everyone have a great rest of the week.
Thanks, guys.